able to achieve if you are not within the university environment. You may need some other means. Rejection rate can vary with journals. You send your paper for publication. For highly rated journal, for example, Nature Science, about 90% they will reject. For some journals, anything you give to them, they just accept it. That's why you find some journals, the language is terrible. There is no, you can just classify the articles as nonsense. They cannot be useful to, in terms of your clinical work or in terms of decision making, because when you read through there, you know that you cannot rely on such things. We do have some poor journals, but many of those journals are not even indexed, even though I've seen some that are indexed, even though anything that you give to them, they publish. Before you send papers to any journal, it's advisable that you know the journal. You may need to editor. When we say know the journal, you should know what they accept, what they reject, the scope of the journal. You also need to look at a few criteria about the journal before you send it. I will talk about shortly. The quality of the work that you are to do is important. You pay attention to the guideline for authors for that particular journal you have chosen. Having determined that it's within your scope, your paper is within the scope of the journal. Now, you must be sure that that paper is going to make good contribution to knowledge. Here is a big problem, because for you to know it making good contribution, you yourself must know what good contribution means. In other words, you have been reading journals, you have been reading research articles, you are very familiar in that area, with that area, the quality of work expected. That's the only way you can know. If you just wake up and say, I'm a clinical pharmacist, I'm going to publish, you will be publishing rubbish. And then you have to be able to determine what needs to be written. And that you can achieve by starting to read clinical journal. There are so many of them, particularly pharmacy related. Pharmacotherapy, for example, is mainly clinical pharmacy. There's a journal they call pharmacotherapy. You have quite a number of them. You also have journals in medicine, internal medicine, which you can make use of. If you look at Norwegian Journal of Medicine, you see some articles there that can be useful to it. So many of them anyway. They also have clinical pharmacy journals. We should be able to be thinking of collaborating with experts. If you want to write papers, you need to think of those who are already experienced in academic so that they can guide you. It's not a question of money. Some may ask you for money, which may not be necessary. You look for the person that you think will do the work with you, that will not demand for what you know you cannot afford. So that, because they also want to publish so that they can get promoted. You need to use, when some will say, use so many references. In reviews, you may be using very many references. In original research articles, it can be a big problem when you have so many references. For example, journal, when indexing journals these days, they expect that those references should be put into the database. If you have a small article, a general article, for example, original research article, and you have 100 references, it's not a review article. You know that that person is going to labor to put that editorial group is going to labor to put those things, convert those things to the data format, which you call the XML format, that they can put in the database for you. So you don't expect to do that. So what they require is current. You try to limit your references to those that are 5 years old as much as possible, not allowing them to be too long. But in reviews, you are free to go anywhere. You can use 500 if you have them. Avoid careless mistakes. I was reading through an article. You look at the data in the table, they don't add up. And when each time you send it back to the person won't even look carefully. You should add both ways, both directions, and make sure that the data you are presenting, they are accurate. You may require a proofreader. It's highly recommended. What you mean by proofreader is an expert who understand at least the subject area and is able to correct your language and the way you put the sentences. One of the things that worries me in my reviewing article, 3-4 sentences, you are starting with the same letter. The boy started, the girl started, the man started. It's very boring to read. Your language, you don't use your local language. And don't use too many words in writing. Those who have the most to say, usually say with the fewest words. You should always learn to be concise. Always learn to be concise. If you look at the introduction, many of us write. You are writing an introduction to an article. It's covering 5 pages, 3 pages. What do you need it for? When some journals will only require just 1 paragraph, a few lines of introduction, and then they want the work. They just want you to justify what you are doing. Now, one of the things about the articles we publish is you spend so much time and maybe money to do the work, but to put it neatly becomes a problem. If you yourself are not a computer expert, you can recruit experts to prepare the document for you so that it can be properly addressed. Your diagrams are scattered, they are bogus. A diagram that an image so that should be in the quarter of a page is expanded to cover a whole page, and wrong labeling, big letters, small letters somewhere else, or too small letters, and so on and so forth. All those ones should not be allowed. Then lines, there are usually guidelines on lines. We don't have to use vertical lines in tables. We use the horizontal lines just at the bottom and just the headers. That's what is always recommended. We then no abbreviations. Usually, every table or figure should be self-explanatory. There's something some of us frequently do. You want to write in a table. You want to write the header for the table. You say table showing table 1. Table showing what that's repetition. It's not necessary. Say exactly what you want to do and make sure that if you remove the article itself, that table, everything is there, which means if necessary, put a footnote, no abbreviations. The hazard part is getting started. You have now decided to write. The time to write is paper is important. Read similar published work. Hello? Hello?
Okay,
Go
sir.
ahead, sir. Go ahead,
You are
sir.
hearing me?
We are hearing
Yes,
you,
sir.
You
sir.
are with me?
Sir.
Yes, sir.
Okay,
We
Yes,
are
sir.
all with you, sir.
Yes,
Okay,
sir.
thank you. Things to consider before writing, time to write the paper, read similar published work, and understand what you are reading. Choose journal, we talk about the quality, scope, the cost, and the index. I will give you some information on that just shortly. Choose a tentative title. Remember that the title is what will make people to be interested in it. There are some articles that are submitted when I don't for our journal. You read the title alone, you just forget, you don't bother, because why would somebody write this clumsy title that doesn't make meaning? It should be sensitive, and that it should send the message that that work is needed at all. I want to investigate whether people go to school. Does that make sense? When you already know that people go to school. I want to investigate whether people go to school during COVID. Does that make sense when you know they already go to school? So those things are important. Now, the issue of authorship. When you participate in research work, It doesn't mean that you go and collect your friends and put their names as authors. That's not right. The people, author, there's qualification for authorship. That is, the person really participated in the work, either in form of data collection, analysis, or in writing the paper. Usually, the first name that appears there is the person who wrote the paper. Now, when we are submitting our names for paper, remember that your first name is your first name. Your last name is should be written last. My name is Patrick Era and not Era Patrick. Always remember to put your names in the journals. That's the way they normally appear, not turning them around the way we were when we were in the primary school or secondary school. Now, there is something usually the terms of taxonomy of publishing. We talk about evaluation, the synthesis, analysis, application, comprehension, and knowledge. You will see some of the aspects of each one when you get to the slide. Now, if a CIVA will advise you, it says choose the right journal. Start from the top and then you go down. You don't go from, you are looking for a better way to get training. You want to get training, maybe it's your first article. Then you may choose a local journal, they will accept you. Now say you have arrived. When in actual fact, it's not supposed to be published. So it's advisable, you look for the top ones, but when they reject it, they will give you reasons why they are rejecting it, so that you now use it to grow. Although it takes time, paper that you can publish in 2 months may take 1 year this time because it being rejected down the line. Unfortunately, some journals require that you even pay for review. You probably want to avoid those journals that will say pay before they will review your paper. So to avoid that extra cost. Now, what makes a journal good? That's another question. We look at the indexing of the journal in recognized databases. There are quite a number of them. Example is Scopus. We have Google Scholar. We have things like Thomson Reuters database. That's one of the highest ones that we can use. We have other smaller ones that normally journals can be indexed. But if you get your paper in PubMed, Scopus, and Thomson Reuters, you are on top. Then again, the journals are rated on what you call impact factor. That is the average number of times paper are cited 2 years, within 2 years of publication. We also have what you call immediacy index. If you look at the impact factor, you'll probably find that Tropical Journal is the only journal in Nigeria that has an impact factor in Thomson Reuters. It's the only journal, which is not too good for the country, because you have journals in Nigeria that are 30-something years old. They are not properly indexed. They have not made themselves available to the international community. We have what we call immediacy index. That is the average number of times the papers are said they do that year of publication. We also have lead or incubation time. That is the average time taken for paper from the receipt of publication, receipt of the manuscript to the time the paper is published. Of course, for recognition purposes, that paper should, if it's a journal, it must have ISSN. ISSN, that is International Standard Serial Number. And if it is a book, it should have the ISBN, that is International Standard Book Number. These numbers, they are, if you want to do the registration, you go to the National Library for your journal in your library, or you want to start anyone, you go to the National Library, even in your state, they will tell you the procedure to do that. Now, when we come to types of journal papers that one can publish, some people can just submit only abstracts. You find that in conferences, they just submit as work is not completed. You have not done the, you are still doing some aspects of the work. You just want to make sure people don't plagiarize what you are doing. You quickly publish the abstract. In the international community, that is always there. Then you have original research papers, the full article that you have review articles, what people have done using secondary data, you review. Then we have case notes, case reports, and then technical notes. Case reports for those of us in the clinic, very often you have a major case, rare case that has been presented, and you want to present it for people. You properly clinical service to patients or the community. We have what we call short communication. Short communication is usually done for papers which you cannot present as full work because the information is limited. So you make it as short communication. And for those in academia, it's not rated as a full paper. It's rated as half a paper. Just more like proceedings. They rate it that way if they accept it as such. Then we have what we call the editorial or the commentary about a particular topic which can appear in journals, which for those in academia, we don't count that one for many people. In most universities, we don't count that one. You have letter to the editor. You can express what you have found or what somebody else has reported that you feel you need to comment on using letters. We also have monographs and books. These are research areas that we can deal with, but we also have a book review. That is probably not more of research. What somebody has done in your opinion. What are the possible future major shifts in research and publication? We have interpersonal collaboration and teamwork with patients. That is very strong and it's becoming stronger because patients are getting to understand the importance of those research as well. Then we have describing and measuring outcomes of interventions. Interventions we have done, it's not sufficient to do it, you should measure it and know what is it. Patients, cultural diversity, and responses to treatment is a major area of interest. We have methodological changes. Every day, people are using different approaches in dealing with problems, complex problems, mixed problems. These are areas. And at this point, I want to permit me to make a concluding remark by saying that research and publication is not only for the academia, but it's also for our pharmacists in the industry, in the community pharmacy, and the hospitals. Non-clinical pharmacists should always seek to collaborate in research and publication. And then at this time, I want to recommend that the regulatory bodies, PCN, should consider publication of research work, research articles as criteria for issuing of annual license. You'll probably find that that's what some countries do to force our pharmacists who are non-academicians to write papers. And at this point, I think there are opportunities for questions. Hello?
Hello, sir. Hello, sir.
Yes, sir.
I think there are opportunities for questions. At that point, if there are details, some of you want some further details, I can address them. I want to thank you for listening.
Thank you very much, Professor Era.
Thank you, sir.
It was quite a stimulating a presentation. In fact, I'm even thinking of going to publish some of my clinical researches and articles that I've written. They simply publication made easy. So we want to say thank you very much for such presentations. The floor is open for questions. If anyone has a question, please, I would like you to raise up your hands, so that I will call you upon to ask your question. The first person that I will give the floor to ask question is Dr. Ademola Suleiman. Dr. Ademola Suleiman, you can now unmute yourself and ask your questions or your contribution, sir. Dr. Ademola Suleiman.
Yes.
Unmute yourself and ask your question.
Good evening, sir, and good evening, ma'am.
Good evening.
Let me start by thanking Prof for this stimulating lecture. I actually want to make two observations, or rather questions. The first one has to do with the privacy that the Prof talked about. But my major concern is in relation to data analysis. I want to tell Prof, or rather share a little experience that most people actually give out their data to be analyzed by another party entirely. And I've seen where people make use of those data to do another thing. Would this one not, when you generate data, you give it out to another person to analyze for you. That person is not part of you. The privacy of the people you have generated data from is already compromised. Two, I have seen that there are times those data analysts can generate close to about 10 variables or parameters, but they may end up giving you 5 or 6 while they keep the remaining 4. I have seen where people are selling publication without necessarily, because they have access to some people's data, which they give it out to you. That is one. So how do we marry data analysis and privacy, especially in clinical pharmacy? The second one that I also want to talk about, Prof, is the issue of publication by non-academician. It is obviously not going to be easy for a community pharmacist or hospital pharmacist, especially where your promotion in the hospital is only based on 3 years of service and not what you have done. I think, especially for the clinical pharmacy specialists, I think PSN and CPANC actually work in relation to the suggestion of the Prof that if you are a clinical pharmacy specialist, then your contribution to knowledge, which can be seen in terms of publication, will be a source of promotion or incentive for you. And I also think that until we begin to see our community pharmacists and the hospital pharmacists in the academic, whether as a part-time contributors or teachers, it will be difficult for me to sit down in my pharmacy and you said that I should be publishing when I'm not likely to get anything out of it. Thank you.
Okay,
thank you.
I think I'll quickly just address the two issues. The very first one that has to do with data analysis. Usually, if you were going to give data to somebody to analyze for you, they should be given as in a blinded form, double blinded form, so that nobody, or rather single blinded, since you already know what you are doing, so that the person does not know exactly where it came from. So that itself can be handled. what can be difficult to handle is you giving data to somebody else to address, to analyze for you, and the person using it for to publish his own work. That is possible. First of all, when you start thinking of publishing work or doing research, you incorporate all the people that you will need in this direction in the system. So that's why when you are publishing, you put their names out where you have statisticians there. You may have those helping you to collect data and so on and so forth. You put them as part of the team. I hope you are getting that. Yes? Hello? They should form part of the team. Yes, the people who you are going to use should form part of it. There are cases where I went to one place, I don't want to mention the place, university, and I found that people were giving data to people who never even passed school to analyze because they know how to use a computer. That's not how to do research. Because when you do your research, you should have in your proposal for that research, you would have identified the type of statistics you are going to use and how to do it, and make sure that you are there to even tell the person how to do it. I had a discussion with a student who told me once that, and I was asking the student, this why the analysis was wrong. The student said, oh, it's a senior lecturer in statistics who did the analysis. And I said, it is not an issue of whether the person is a professor. It is an issue of the person understanding what you are doing. The person in mathematics or statistics is not in clinical pharmacy. It's not the person that designed your work. He doesn't even understand what you are doing. And now you are asking him to go give you data. He's only giving you data. It's not analyzing what he's supposed to analyze. So that's why at the beginning, you get people involved, experts involved in the data side to make sure that at the end, you have a proper analysis. On the second issue of non-pharmacists, pharmacists in the community and all that are not publishing, the very first driving force should be what you will get from the work. For example, many of us in academia, you may see the lecturer driving cars, living in big houses. It's not because of the 10 kobo they are paying or the handout you think they are buying. In most schools of pharmacy, people don't collect handouts from students. You will find it's because of all those grants, the rewards they get from research. That's what they are living on. There are even all these NGOs, they are doing research and they are living big, building houses and living very good lives. As I said earlier, conferences, going abroad, sponsored from your research. Those should be the driving force, not whether you are not going to need it for promotion. Nobody says you should need it for promotion. You sit in the hospital, you are waiting for your salary. When your mates are from one study, they will get 20 million. Let me give you an instance. If you get, for example, a World Health job to do maybe a contract, maybe they ask you, they give you $100,000 to review drug use in Nigeria. You may find that you may not even need up to half of that money to get that work done. And the remaining half, $50,000, is for you. And that work could be completed in 3 months. And your money is in your account. So your salary, that's your salary for several years. And that's why people in academics are surviving. If you look at the salaries of lecturers, it's very small compared to even those in the hospital, but they are surviving, and you see many of them are living big because of those things. That should be the driving force. And then what you will benefit, the reward from recognition and others, other than the financial reward. And I hope those answers will address those two issues. Thank you. Hello?
Prof, can you stop sharing your slides, sir? Can you stop sharing your slides?
Huh?
Can you stop sharing your slides? Yes.
Okay.
Okay.
Stop sharing your slides. Thank you, sir.
Okay. Dr. Ademola, are you comfortable with the answers given? Dr. Ademola Suleiman, are you there? Okay, I will give the floor to our EBO chairman, Dr. Joseph Mandu, for his questions and contributions.
Okay, thank you, Pharmacist Williams. Good evening, everyone. I hope you can hear
Good evening,
me.
sir. Yes, we can.
I hope you can hear me clearly. Okay, sorry. I have issue of network here, which has been oscillating. I want to thank Professor Era, my lecturer, the guru himself in research affairs, and so many things about clinical pharmacy. The first coordinator of PharmD program in Nigeria at Uniben. Prof, you're welcome, sir. This is a great honor to for having you today by CPAN, and you have indeed done a lot of justice to this topic. We have all learned. It has increased our bank of knowledge as usual, and we hope to see you some other times more. But then I want to inform us that we have the Nigerian Journal of Clinical Pharmacy and Therapeutics. That's the upcoming CPAN journal, though about to be registered, and it has Professor Chinwe Ukwe as the editor-in-chief, Professor Okpara and other persons there as members of the editorial advisory board. I want to use this opportunity to plead with Professor Era to also join us. He will be a member of the Nigerian Journal of Clinical Pharmacy and Therapeutics. Sir, I would like you to be a member of the advisory board of that journal, so that all these things you have taught us this night, you also help us to ensure that they are properly kept. And then I want to also thank you on the area of
Hello?
I think the network is.
Yes, network is.
Yeah.
Question or saying that PCN should be part of this. Yes, if peace, is it a guideline? Can you hear me? I can hear you. Can you hear me? Can you hear me?
Yes, we can hear you now. We can hear you now. We can hear you now, Dr. Mandu.
I hope. Okay, I hope Prof got what I said. I'm inviting him to the CPAN editorial board. He will to be part of us in the part of the Nigerian Journal of Clinical Pharmacy and Therapeutics. I want Prof to be part of the advisory board, editorial advisory board. Are you still with me? Can you still hear me, please?
Yes, we are hearing you, sir.
Anyhow, let me just
I'm thanking Prof. I'm thanking Prof for also bringing up the issue of encouraging people in community practice to publish. I know that in our profession, we don't have a lot of all these challenging things, and that is why you find people in medicine, for example, people are challenged, and this is why people read more, people publish, and all these things add to their what they get. Don't get people's salary are based on their years of service. This is not too good. So I know because of network, I may not put in so much now, but then I want to thank you very much.
Okay.
I'm through. Yes, thank you. I believe we got some of them.
Thank you very much.
All right.
Professor, we want your response to what the chairman has just said.
Okay, now the issue of the journal is a welcome development. Generally, the success of a journal depends largely on a number of factors. One of the factors is the editorial board. and then you have other issues meeting the international requirements. Otherwise, it just dies at the lower level. So I would recommend that you find those factors that will move it from the lower level to the upper level. So for those, so that it will become international journal and acceptable outside, and that is published regularly. As you say, you can put my name there. That's okay. And anytime you want my advice, there is no problem.
Okay, sir. Thank you very much, sir.
Okay, thank you very much, sir. We quite appreciate your contribution, sir. Please, the floor is still open for questions. I want to call Pharmacist Florence A for her contribution and question. Pharmacist Florence. Pharmacist Florence, you have the floor. Okay.
Can you hear me?
Yes, we can hear you now, Pharmacist Florence.
Okay. Thank you very much, Professor Patrick Eraf, for your wonderful presentation. So my question goes, if one is actually trying to do a master's, is it best you do a research work or you do a third course? Because research work, basically most times you need funds. Is it compulsory you be sponsored? So that is my question.
No, I didn't get the question clearly. Other than, is it in doing masters you do research work? What is the exact?
Yeah, I'm saying, is it the best doing a research work? Is it the best approach, or you just do a third course? A third course, like normal course, classwork and everything.
Well, NUC recommendation is that you should no longer have just a third master, that they should be by a minimum of 2 years. That means you do research along with it. That's the NUC recommendation. Having said that, even the so-called third work, there is always a research part attached. Huh?
Okay. Yes,
there's
sir.
always a research part attached for the master's program. Because any university that does not put that seriousness in the research part, it obviously means that that university has a problem. Why? Because many people will do their master's degree and end up going to lecture. You are not.
Okay.
You can only give what you have.
Yeah.
If you look at the academia today, there are pharmacists employed as first degree holders. Yes?
Yes.
Then you have the second level, with the minimum required by the NUC is a MSc on a PhD program. If you are on an MSc and you are not in a PhD program, you are not supposed to be in university as a lecturer. And so when we go for accreditation, you don't meet those conditions, your name is struck off the list as a lecturer. The university can be paying you, but you are not recognized as somebody teaching in that university. And that's what it is today in the pharmacy. Okay? So it's important that anybody doing MSc should do. But let me also put it on the other hand. You are not going to leave Maiduguri to come and do masters in Benin because in Benin there is research, in Maiduguri there is no research. You do your master and do your PhD there. Then join the two, and then you are still better on than going to look for money that you don't have to come to Benin, and then your other issues, you abandon your family. By the time you finish, your husband has married another woman, has other children outside. Okay? So you have to consider a number of factors for your convenience in choosing where you do your work. You can do it conveniently from the nearest place to you. I hope that is clear. Hello?
Hello?
Pleasant.
Yeah, I hope she's hearing. I hope she's hearing.
Pharmacist Florence. Pharmacist
Pharmacist
Florence, I
know.
hope you are satisfied with Professor's response. Oh, she's no longer there. Pharmacist
She's no
Florence.
longer there.
Okay.
I'm here.
Okay. Are you satisfied with Professor's response?
Hear you. Yes, I am, but it's just one question he didn't answer.
What is the
Okay, go
question?
I asked, must you be sponsored or you're going to finance everything yourself?
Okay.
Sponsorship is
No,
compulsory.
the question is, when you say sponsor, must you be sponsored? Nobody says you must be sponsored. You are free to do your masters from your own pocket if you have the money. If you don't have the money, you need sponsorship. There are scholarships for federal government gives scholarship for masters program, and some institutions also fund their staff. For example, in my institution, academic or non-academic, if you want to go for advanced studies in your own area, they allow you to go on study leave. On study leave, we pay is sponsorship, whether they add extra money to you or not. That they are giving you leave and you are still earning your salary is sponsorship. That is there in the civil service rule. You also have the risk scholarship you can apply for. Many of the scholarships we use for postgraduate programs like the Commonwealth and all that, which you can explore outside your country, they are competitive. You apply. You also have the TED fund. The TED fund grant is there for you to apply to. You have to go through the institution where you are doing your postgraduate, or you ask to establishment. In the website is always there, and the information is always there on how to apply. So you should make use of them. Even your children, there are scholarships for them. Just to make use of them. That's the important thing. Okay, some institutions are even asked to submit names. Like if you are in a university, they will write to the vice chancellor and say, send so many names. Often when they say do that, they will send the information late, and then by the time you are applying for all the transcript and all that, you are already late. That's why you have to be proactive to know when those scholarships are available, and then you apply. There is also what you call studentship. Studentship, for example, if you are abroad, there is what you call, in other words, they actually take you on a salary while you are doing your studies. All those are available. If you apply abroad, you can ask what is available once you are giving admission. If it's locally, the Federal Ministry of Education, you can also ask from your state. They also have various scholarships which are available that you can. But interestingly, even local people sponsor projects, companies, pharmaceutical companies sponsor projects. If you are lucky to be with a supervisor who has contact with those companies, he has money and he wants to recruit students to do the work. Okay? That's the way it is. Thank you.
All right. Thank you very much, sir.
Okay. Thank you very much. I want to call on Dr. Felicia Williams for her contributions and questions. Dr. Felicia Williams.
I want to thank Professor Era.
Okay.
Can you hear me?
Go ahead,
yes.
ma'am.
I'm hearing you and I'm seeing you.
Yes, I want to appreciate Professor Era, my classmate. You reminded me of those times in Uniben that we used to.
Hold on. Felicia,
and my supervisor, and my teacher.
My colleague.
Colleague.
Yes.
That is it. We really appreciate you. There is a point that really struck my attention with the recognition of the consultancy cadre for pharmacists in the hospital. Research and publication is one of the ways that can make us really visible and relevant in the system. a medical doctor, no matter how new or how young the profession, knows that he must do research and publish. So for pharmacists, if we adopt that kind of attitude to research, to learning, it will make us relevant, make us visible, and make them realize that, yes, pharmacists have really come. Thank you so much for that point you have made.
Okay. Thank you very much, Dr. Felicia. I want to
Felicia, just a minute. The contribution made by Felicia is very relevant.
Okay,
very relevant. But I also want to say something. And I'm sure in the group you have academicians. Okay? The universities, I'm sorry to say this, are also not too helpful in this matter. When by now, we should be, the universities, even though we have our curriculum already designed, there should be a reflection of, in terms of course objectives on what we want to achieve, like this issues you have just raised. You have consultants. The training of the, rather than just the textbook training and all that, the more emphasis now has to be laid on these people being able to focus their attention in this direction of providing useful information in the care of the patient. They require a different training than just the ordinary classroom lectures. I think we need to focus more attention in this respect. As of today, our pharmacists going to world rounds. They just move around without a proper focus.
Hello, sir. Hello, Prof.
Hello. Hello, you are hearing me now?
We lost you at some point, sir.
Okay, but we are hearing me now.
Yes, we are hearing you now. Very well,
okay.
Sir.
Okay, so what I'm saying is that the schools of pharmacy also need to look at this area so that in terms of training, this aspect is brought out properly so that when the pharmacy at the postgraduate level, even at the undergraduate level, they are coming out, they have a better practical exposure to these areas so that they make better contribution in the care of the patient, which the doctors are interested in. Okay, I remember this during this special family program, the experience in Syria alone, where I decided to enter some of the wards. The things I saw there, the doctors were so happy that they made sure the pharmacists, those who were there will remember what happened. They made sure that the pharmacists were with them in all decisions. Within the few days they stayed in the hospital, so because they could never have seen better things in terms of patient care than the presence of the pharmacists who were in the hospital that period of their rotation. Unfortunately, I don't know whether they continued as we agreed that they should continue going there. I don't know whether they were able to achieve that. So we should be able to do that in the schools and make sure that the other health professionals are getting better results from us, not noise this time. Because all we are doing is making noise. We are able to do this, but the output is not there. Okay? So Felicia is right.
Yeah.
We need to have a new design. And interesting issues in the academia, and in clinical pharmacy, we have a new design that is able to say, this is what we are able to do. Maybe we start from small things and then expand them further so that they will benefit more.
Okay. Thank you very much, sir.
Unfortunately,
can I just chip in something?
Yeah. The consultant they are talking
Can I
about.
just chip in something?
Yeah.
Yes, you can, ma'am.
Okay, Prof.
You can go ahead, ma'am.
In Unilorin, yes, in Unilorin, we have a research group comprising that comprises of pharmacists in academia and in the hospital. Dr. Bello is part of that research group. Dr. Udupe Olariwaju, Dr. BJ, Ayetoro, Dr. Bello Shakirat, Dr. Ayoni, Dr. Amali. So we have started something in Unilorin and UITH, and we are making progress. Thank you.
Okay, now let me ask a question there. Who is the lead in this case? In the research group, who is the lead?
Because the program was, the research group happened to be the anchor person for a training when the research lead we went for, who is in the hospital.
Hello?
We had to see that to her because she happened to be the anchor person. Hello, can you hear me, Prof? Hello,
can
you hear me, Prof?
The reason why I'm saying that is this. The reason why I'm saying that is this. It can be a marriage of convenience, the way you have done. It's a good way to start. But we need something more than marriage of convenience. Okay? You need something more than marriage of convenience. What we are saying is that there should be greater input. The person you may be collaborating with may not even have the experience of what you want to do. The person, one of the ways I want to look at it is that clinical experience for the clinical pharmacist, your topic should focus more on what you are able to do, what you are trained to do. And then those people you are adding can be there. You can call them anything you want. If you want to call them the lead or co-lead or whatever, it doesn't matter. But who takes charge of what you are doing, the results and all that, that should be pronounced. It's not really who is the head that is the important thing, but who actually controls what happens and how is the work going to show the presence of pharmacists in the system, and that is a major thing. It's not a question of being a follower. We should go beyond. Once you have gone your training, you are supposed to be independent. If you now say every work I'm doing, I must work with the doctor, that's okay to work with them, but the doctor must be my boss. No, he will decide what you do. Okay?
Sorry, Prof, let me make a clarification.
Yeah.
All the persons I've mentioned have their training for PharmD, they are pharmacists.
I agree. I'm not saying you are doing anything wrong. It's fine. But I'm saying generally, we should try to make sure that what we are doing, we have control. Okay? You need the expertise from the medics. You need the expertise from other people. But as much as possible, not in all the cases that you can have control. That is the truth. But what I'm saying is that you must have something you are saying, you are bringing out that they will be interested in. Okay? That is the major thing.
Okay, thank you very much. We have 3 questions and we want us to take it as fast as possible because we're actually running out of time. Even though the lecture, the presentation is quite stimulating, we are learning a whole lot. It's quite revealing. I want to call on Dr. Alphonsus Peters, please. Dr. Alphonsus.
Oh, good evening, Prof.
Good evening.
You're welcome.
Once again, Prof, thank you for your special PharmD training. We were the first set.
You should mute him. All right.
straight to the point, I would like to ask about your opinion about involvement of community pharmacists and the academia. Is it feasible from your own point of view that maybe a memorandum of understanding or an agreement of collaborative research, can be constituted such that community pharmacists will be stakeholders in each research that most academia would do in clinical pharmacy? I want to know what your input or what your advice would be, considering what you have said that community pharmacy are weak in that area and elsewhere they are well represented, whereas here it appears they are actually being edged out of most research. Thank you.
Okay. If you ask me to address that question directly, I would just say the very first thing is that the community pharmacists should now be interested in research. They have to first of all show interest in research. They want to be reading the papers on research. They want to be able to attend both local and international conferences that have to do with research. Okay, that's one, research and publication. Having said that, in most cases, it is the person in academia that will initiate a research work that will take place in the community pharmacy. Okay? Yes. There are also few cases where a community pharmacist will walk into the pharmacy and say, oh, I have so, I'm interested in evaluating it. Most of the time, when you look at what the person is saying, it may not make much academic sense, but it makes a personal sense to that person. And the project will more or less end there. Okay? When they come out, I want to be able to do this, and you tell the person this is what is involved, and he says, oh, no, I didn't think that way. So, but when most of them should be, if they sit down together, let's start with community pharmacists participating in departmental clinical meetings, in student seminars. When they know postgraduate students are giving seminar in the faculty, those around will come and participate. They start getting interest. Okay, they should also be interested in participating in trainings where grants trainings, because that will enable you to get money to attend conferences and be able to have something to do with research. They should be showing interest. You go online, you see the training. Some of them you can do online without paying 10 kobo. You just go online, register, and participate in the training. Some of them have websites, already materials there, and all you is waiting for you to just plug in and look through the materials and get them. You may not get BSc or PhD or PharmD, but you have now acquire the knowledge. That is the training we are talking about. Research, you go online, okay, how do I do research? What are the modalities for research? You have that knowledge. That is important. I would like to appeal to the schools of pharmacy, particularly departments of clinical pharmacy, to be designing things around the hospital and community pharmacies as well, even student projects that can pull them in. And when we send students generally to the community pharmacies, most of them don't show interest other than just, okay, I will tell you how to do this. They don't show interest in the real research. That is a major problem. And that is what we have brought them in to participate. Okay, I'm interested in what you are doing. I want to be a part of it. They don't want to be a part of it. They just want to give opportunity to a student. Let me not disturb the student in collecting what is interested. That's where we have a little bit of issue. Maybe during community pharmacy conferences, these issues, maybe invite people to talk to you about all these issues. It will be different. I know the Community Pharmacy Association last 2 years tried to do something, and I was there. But the way they were thinking of it again, it showed some. I had some concern, and I'm sure that's why you also had some issues that appear not to have probably made much progress. So if we start doing it, participating in things, you now know where to go in. And as I said, also, we also need to be doing things seriously. Be interested in bidding for research grants, the community pharmacists, and you get money from them. You should be interested in bidding, learn how to write grants, and you'll be bidding for those things, because that's one way of getting somewhere. I hope that addresses your question.
Yes, thank you, Prof. It's okay.
Okay, thank you. Thank you
Yes,
very
please,
much.
can I chip in something? Francis Williams, please, can I chip in something?
You can, sir.
Yes.
Hello?
I'm
Yes,
listening, sir.
still
Sir, the
based on
floor
what...
is yours now.
Yes. Yes, please, based on what Prof has been saying, and everybody is talking about community pharmacy. That's the beauty of CPAN. Because CPAN cuts across. There are community pharmacists in CPAN. There are 2 pharmacies that are academic. And we have that plan of having a kind of continuity of both care and research and training. We shall have some interactive session with SCPN very soon. And I think this lecture this night has given us some insights on some of the pleas and a discussion that we shall be making with SCPN leadership. So I want to assure Prof and every other person that by the time we shall be meeting with the SCPN leadership, these are some of the eye openers that we shall be tabling before them. Thank you.
Thank you very much. We are looking at our time. I want to plead with the Prof. These 2 other questions, I want them to be asked together before Prof we answer
That's
2
okay.
of them. I don't know if it's okay by you, sir.
Yes, fine.
Okay. So Dr. Ejiro and Dr. Dauda Dadiwa, I would like you people to ask your questions, starting from Dr. Ejiro. Dr. Ejiro, the floor is yours, sir.
Thank you very much for this opportunity. I want to especially thank Professor Era. I'm not surprised because he trained me at my undergraduate level in UDB. And so I didn't expect anything lesser than what we saw tonight. However, having said that, mine is more of comments. On the issue of research being the basis for license renewal, that might not be possible, especially for those of us in the hospital. Now, civil service rule does not allow that to be the yardstick as far as hospital practice is concerned. However, I must commend pharmacists. Through CPAN, we've been able to see that there are lots and lots and lots of pharmacists who are interested in clinical practice and clinical research, both in the hospital and in the community. The major problem I see in all of this, like I was discussing with one of the deans during our trip to the PSN conference at Oshobo, it still boils down to the practice, the training of pharmacy students. The disconnect between academia and hospital, academia and the community pharmacists. Especially with the approval of the consultancy cadres, we have academic pharmacists who are consultants. We have hospital and community pharmacists who are consultants. And I was asking, why don't we have a scenario like we have with our medical colleagues? Why can't the hospital pharmacists be part of the faculties of pharmacists? Why can't the community pharmacists who are consultants be part of the hospital, the academic, the faculty of pharmacists. Why can't the faculty of pharmacists who are consultants in the faculty of pharmacists be part of the hospital practice? We need to fix that. That will bridge this gap between the academic pharmacists doing research and the hospital pharmacists not doing research. Now, it will also be an incentive for the hospital pharmacists and community pharmacists to fall on with research, because he knows that because he's part of the academia in a form, with his constant publication, he can become a professor too. There is there is an incentive, as it were. So, and I also want to encourage academic pharmacists that when they are getting involved in researches, they should also get involved in practice, clinical practice researches involving hospital pharmacists, involving community pharmacists. All the publications I have today is in collaboration with academic pharmacists. So there are lots of hospital pharmacists, community pharmacists who are interested in research, who needs to be working together closely with the academic pharmacists. And there are lots of pharmacists in the hospital who are members of hospital research ethics committee. Like in my center, I know some of us are part of the hospital research committee. And like Prof mentioned, a lot of hospitals, hospital research committees are just there not recognized. But it's also true that many of our hospital research committee are recognized by the National Research Ethics Committee, and you have to renew your license, I think every 2 years or thereabouts. And renewal of license means that members have to undergo certain form of certification on research. And a lot of pharmacies, which I have come to see from CPAN, have been involved in. So we need to rejig our pharmacy schools. There's need for the academic pharmacy to open up this space, allow hospital and community pharmacists who are consultants, who have postgraduate degrees, to also be part of the system. That way, we can drive this research and practice in pharmacy to the next level. That's my little contribution.
Okay. What of Dangiwa?
Dangiwa.
Is Dangiwa still there?
It seems he's not there, you know.
Okay. So, I want to thank Ejiro, if Dangiwa is not there. First of all, the civil service rules were made by a man, and they are changed by a man. And that is why the civil service rule was what made you, the pharmacists, stop as chief pharmacists, later as directors, okay? And now as consultants, and so on and so forth. It is the same way that they can be changed. In the university, in the United States and usually Britain, many of the people who come to teach in clinical pharmacy from the hospital, or we call them preceptors here in terms of interaction with the hospitals, they are the clinical associate lecturers. They call them clinical associate lecturers. In the US, they say clinical associate professors. They are primarily working either in the community pharmacy or in the hospital, but are employed in the faculty of pharmacy to teach the students nearly always in their places of work. For example, a teaching hospital pharmacist is employed as a clinical associate professor to teach the students, to take them around, and then come and give some lecture. Usually a very small fraction. I remember in England as a postgraduate student, that person comes to the faculty once a week. He or she will have an office in the faculty. and comes there, and other days is in the hospital. But just as you said, we have a civil service rule, which presently has not made that provision. And the approval of this consultant cadre will also have been an opportunity to address that. But those who pursue that, either they were limited in terms of power or force, or they were limited in terms of foresight, which is in most cases is the problem. You try to address things one way, what you need today, and not look at it in another direction. And that's why pharmacists are most of the time be shortchanged. For example, the optometrists have approval from the Ministry of Health to be receiving call duty, those in public service, like universities and so on. Why the pharmacists are not? Because of those foresights. You were pursuing clinical associate professor, sorry, the consultant cadre. And as far as we are giving the consultant cadre, it's okay, but not married with the other benefits. Maybe when the family issue is being addressed, those things will be put in the garden. One of the things that the council needs to work at is to even address some of these areas so that at the end, we have a blueprint of what the pharmacy should be. Unfortunately, we don't have a residency program. And that residency program is one of the things that is limiting this issue of clinical associate professors, so that the universities can now put them on board. But I also want to appeal, maybe as we grow in our various universities, we have a pharmacist who is a vice chancellor. Those things can be put in place as well, because it's easier for that person to understand that they need clinical associate professors from the hospitals and community pharmacists, rather than the dirty job of being just a preceptor. And I think that should be a way forward. For now, I don't think the university system has that position, but it can be created anytime, depending on who is in charge and the force that is involved. We should all work together and I'm sure CPAN should be able to also work towards that, to working with the PSN and the registrar's office. Then the universities will be required during accreditation. They say, where is your clinical associate professor or clinical associate lecturer, rather than just a preceptor? Then they will incorporate them. But you also have to look at it on one side. If you are saying the pharmacists in the hospitals should come and work and salary in the university, what are the pharmacists who are in the university who are also not being enjoying the same opportunity in the hospital? It has to be both ways. That's where the academia is under Ministry of Education, while the hospital is under the Ministry of Health. And those things will need to be resolved centrally, so that those in academia, at least in the clinical pharmacy area, can now be employed as consultants to work in the hospital, while those in the hospital can be employed as a clinical associate professor. It will be neater that way. But whichever one comes first, it's all a matter of pressure and understanding, letting we be involved in politics. That's okay. I hope that addresses Ejiro's question.
Perfectly, Prof.
Or rather, with the comment.
Very well, sir, Prof.
Thank you.
Thank you very much, Professor Patrick Era, for this wonderful presentation. I want to call on Dr. Felicia Williams. I like it when I call Dr. Felicia Williams because she's my namesake too. Ma, please unmute yourself. Unmute yourself, and you can do the closing remarks and then pray for us.
Can I just make one objection? I'll do the closing remark, but I will not pray. Someone else will have to pray for us.
Mommy, please do that for me now.
Someone else will have to pray for us. Thank you so much.
Okay.
On behalf of CPAN members are here, we want to also recognize some professors are here too. I saw Professor Suleiman here. I hope he's still around. Recognize you. Fellows of Pharmaceutical Society of Nigeria, we recognize you. Fellows of West African Postgraduate College of Pharmacists, recognize you also. On behalf of CPAN, we want to appreciate Professor Era for this, will I say, stimulating, inspiring talk this evening. We really appreciate you. He has opened us from our slumber to look at clinical research, clinical practice. Thank you so much, Prof. We appreciate the role you are playing in moving the profession forward. PAMD has changed so many lives, and your talk this evening is going to change so many lives. I want to thank the chairman of CPAN. I want to thank all the ESCO members, the education committee that is making sure that we have our update every week. I want to thank all participants. It takes real interest and determination to be up at this time after a whole week of activity to participate in this object lesson. I want to thank you so much. We look forward to having another fruitful, peaceful, interactive, interesting discussion next. Thank you so much. Please, Williams, hold on somebody else to pray for us.
Thank you, ma'am. Please, Dr. Solomon, please help me pray, please. Unmute and help us pray. Dr. Solomon.
Hello?
Hello, Dr. Solomon.
Hello, can you hear me?
Yes, we can hear you, sir. Go ahead.
In Jesus' name we pray.
Amen.
Father, we thank you for today. It has been so wonderful. Listening to our own renowned Professor Patrick Era for this pervasive lecture he has given us today. Father Almighty, we call upon you to make it a point of honor with our mindsets, that this lecture will go deep into our consciousness, into our minds, into our doings and our workings, to promote CPAN to be more enviable in a committee of other clinical associations in the world. We make this prayer through Jesus Christ our Lord.
Amen. Thank you very much, everyone, and have a blessed evening.
Yes. Sweet dreams and good night.
Good night, everybody.
Good night.
Good night. Good night.
Thank you, Dr. Bello. Thank you, Dr. Bello, for your good work.
Yeah.
Good night, boss.
Good night, everybody.